The standard treatment for atrial fibrillation is twofold. The first is to reduce or eliminate the risk of a stroke. The other is to treat patients' symptoms. So if they experience palpitations, fatigue, or shortness of breath, one option is to try to control the heart rate and prevent it from racing. But if it's relatively newly diagnosed, what we try to do, and research has shown that restoring normal rhythm and trying to maintain normal rhythm and preventing bouts of atrial fibrillation is probably a more optimal approach. There are various therapeutic regimens that we use to treat atrial fibrillation. In our attempts to try to restore and maintain normal rhythm, we use medications that either block the potassium channel or the sodium channels in the heart and help regulate the heart rhythm. More and more, we're using ablation as a form of therapy for atrial fibrillation. And what we've found out over the years is that we think the trigger for atrial fibrillation comes from the pulmonary veins that enter into the left atrium. So there's generally 4 pulmonary veins. And so our approach in ablating patients with atrial fibrillation is to electrically isolate those veins from the rest of the left atrium. And we do that by either heating the tissue up or cauterizing, that's called radiofrequency ablation, or cryoablation, where we freeze the veins. The most widely used technique is a left atrial appendage occlusion using a Watchman device. And right now we're in the second iteration of the Watchman device called the Watchman Flex, and we deploy the device through the femoral vein and going up into the right atrium, performing a transeptal puncture where we access the left atrium, and then we deploy the device in the left atrial appendage. Procedure takes about an hour, and research has shown that it's just as effective in preventing strokes as blood thinners, but you don't have the risk factors of bleeding long term. Traditional pacemakers have involved placing electrodes or wires, pacemaker wires, from the left or right subclavian veins, and then fishing those wires into the heart using X-ray, and then connecting those wires to a pulse generator with a battery that's a source of energy that conducts electrical impulses through the pacemaker wires into the heart. The challenge with those pacemaker wires is that the heart's constantly contracting, so there's wear and tear on the pacemaker leads. The other challenge with the traditional pacemakers is that the battery longevity on the generators is about 8 to 10 years. The third challenge is we are at the mercy of patients having open venous circulation that connects to the heart. And then the fourth issue is if you develop an infection, say because of a battery or a pacemaker generator change, it's a straight shot to the heart. So the infection can go from underneath the skin directly into the heart, transmitted through the wires. So if you get an infection, it could potentially be life-threatening and cause infection in the heart. So to get around some of these challenges, the latest sort of advancement has been what we call a leadless pacemaker. And that's a capsule-like device that has both the pulse generator and the battery and the ability to stimulate the heart all at once. The risk of infection is much, much smaller. The battery longevities are right now at 5 years, but with advancements, we're thinking that we're going to probably have similar longevity, 8 to 10 years with these leadless pacemakers. As we discussed, the two areas that we concentrate on is stroke prevention and restoring and maintaining normal rhythm and treating, preventing atrial fibrillation. The innovations that are coming down the pipeline are mostly in this arena where there's newer devices to prevent strokes. There are other companies coming out with a different shape, different ways of delivering it. So I see advancements in new mapping technology, treating patients with congestive heart failure. Now we have special devices that can help treat congestive heart failure. So there'll be better advancements in targeting different areas of the heart for pacing.